Hi everybody, happy Friday. Today is December the 4th, and as you can tell, I am very much into the Christmas spirit and excited about what this month brings. So let's dive right in. All right, let's start with some team member highlights. So we have an anniversary coming up here in the next week. Lisa will have been with us for 1 year on the 16th of this month. So congratulations, Lisa, and thank you so much for joining our team. You have been a huge asset, so we love you. And happy birthday to Jennifer, who turns a year older on the 11th, and Min on the 13th. So happy birthday to both of you. Hope you have great days. All right, medical center updates. This one's a little bit longer. All right, there's a critical to safety CBL that you've all been assigned, and that is due on the 18th of December. It's in Workday Learning, so if you haven't gotten into that, please make a point to try to do that soon. So by the 18th is the deadline. We still have 25 team members who haven't completed it, so please let's try to get that taken care of before the deadline. Please remember to do your Who's Well check every single time that you're scheduled to be on grounds. That's, even if you're coming for a class or a shadowing experience or something else, you still need to do it. You don't need to do it if you're not scheduled to be here. If you're scheduled to be here and you are having signs and symptoms that are listed on that and you click yes, I have symptoms, you need to notify me immediately, okay? You can do that by text. Even if it's in the middle of the night, that's fine. But we need to do that because we're tracking that and discussing it in my morning and my evening staffing calls if we need to think about making adjustments to staffing. The COVID surge, unfortunately, is still a very real thing. The COVID units have been running over 30 patients between the ICU and the acute care floor. That's 4 South and 5 South. So our staffing may need to be stretched here and there to try to accommodate for the extra nurses that they need in those units. I know they asked us to stretch this morning, and we got kind of creative, and I give props to everyone who was scheduled today because everyone had really good attitudes, at least that's what I saw, so thank you for that. It seemed to level itself out now, but that could happen again, and I've been talking about it, and I don't want to be like a cry wolf kind of thing, but we may be asked to do some creative staffing plans in the next couple of weeks, especially since a lot of these positive patients are happening after the holidays. So after the Thanksgiving, they met with family or friends or things like that, and we've had a lot of people turn positive. Same thing is likely to happen around Christmas, so we just need to buckle down a little bit. Okay, speaking of COVID and COVID shifts, so keep in mind that when you're picking up COVID shifts or red and yellow shifts, it's really all the same, that if you call out of a shift in the same pay period where you have that bonus money, if it's not approved by employee health, so like if employee health puts you out on a quarantine, for example, then my understanding is that you can still get that bonus money because you're still being paid for those shifts just under a different pay code. But if you get sick, legitimately it happens, and you call out because that's what happens sometimes, it's all right, then you don't get the bonus money for those COVID shifts or the red shifts, yellow shifts, for those shifts during that pay period. So just be cautious and be aware of those kind of things. Octreotide is now on the pharmacy shortage list, so you may have more trouble getting a hold of it, so just be aware of that if you don't see octreotide on your patients. And I know our providers have been made aware, but they may need reminders as well. Okay, I want to spend a little bit of time on this next point. So you may have checked your email, maybe you didn't, but the hospital is doing a reorganization a bit of some of the ways that they designate service lines and some of the leadership strategy, some of the leaders in the unit. So the nuts and the bolts of it are that there will be 4 primary service lines. Transplant is one of them. So you, as the nurses and the techs in the unit, really shouldn't feel a big impact of any of these changes. I'll probably feel it a little bit more, but just be assured that nothing really is changing on your end. You're coming in, you're taking great care of your patients, and doing everything that you need to do. I will still be here. I will still be the manager. Ben will still be here as the director, so I will still report to him as I always did. The difference a little bit is that Mary Dixon, who's our CNO, is basically now taking 100% ownership of all of the units in the hospital, every single unit in the hospital. So you might see her pop in more frequently because that's part of it, is she really wants to know what's going on. And you know, I expect to see her a little bit more, but as far as you go, nothing's really changing. Some of our sister units and colleagues, they might feel it a little bit differently, so we need to act with compassion and just sensitivity to that. The scary part in this is that with these 4 particular service lines, it's oncology, transplant, cardiovascular, and neurosciences. These are the 4 areas where we are really, you know, UVA is really pushing forward, being very innovative. You know, you can't go to Martha Jefferson and get care for a complex head bleed. You can't go to Martha Jefferson to get a kidney transplant. You can't go to AMC and get a heart transplant or things like that. So you got to think about the things that UVA does that other surrounding community hospitals aren't able to do. That's where, you know, that's really driving forward. So that's exciting. The hard part is kind of once you get to the top, staying at the top, and we really transplant, because of you guys and the work that you do and the care that you provide, we really are at the top of our game. So now we're going to be looked at to stay at the top of our game, to continue all the things that we're already doing, to continue providing excellent care, you know, getting great patient satisfaction results, and that really just comes from providing excellent care and from being innovative and creative and open to new ideas. So it's that pushing forward. So like I said, you do have an email from the institution. It might feel a little convoluted and you might be confused, but that's kind of the nuts and the bolts of it. I'm happy to explain it to anyone who has additional questions, but the bottom line is nothing's really changing for you. I know that there's still you know, we've been told we're still moving to a bigger space at some point. I do think they're kind of waiting to see, you know, if COVID slows back down after the holidays. I don't know when that will be, but I have been told to continue interviewing and continue hiring and continue building our team. So those are all good things. Again, any other questions, feel free to let me know. All right, one thing that I wanted to bring up that I thought was really interesting is I was reading some of my emails today, and I get this transplant newsletter sent to me. And, you know, speaking of the moving forward and being innovative and growing and things of that nature, the statement was there are over 100,000 men, women, and children on the transplant waiting list as of this year. And during the pandemic, the delay for transplantation has been a little bit longer. According to the U.S. government information on organ donation and transplantation, a new person's name is added to the list every 9 days. Every 9 days, guys. That just blew my mind. I knew it was high, but seeing a number really, and of course that's an average, but it really hit home. And that the average wait time is 4 years. Kidneys rank as the most needed organ with a higher rate than liver, heart, and lungs combined. So, I mean, I don't think that's a huge surprise to any of you, but it's just a reminder of reconnect to purpose, that what we're doing is important, and a lot of these patients, they're desperate. So thank you for showing up every day and for being present and for loving this patient population as I know that you do. And last but not least, the Aspire values. So the Aspire value that I want to talk about today is excellence. And the definition in UVA's Aspire values is conducting ourselves in a manner that surpasses ordinary standards through preparation, collaboration, and proactivity in all that we do. So with that in mind, we received another award, and it is the Patient Experience Achievement Award. I'm going to put this out in the unit a little bit later today, and it's for FY20, and it's recognition of outstanding patient experience. We are considered a top performer with a rank of 95%. And as I read through the criteria for top performer, it says earned a percentile rank of greater than 90% and had at least 50 returned surveys. I just think this is phenomenal. I mean, we don't see the volume that a lot of these other units see as far as discharges go, so sometimes we don't see as many as others. So which means a few surveys, you know, it can change our percentage in a great deal. It's easier when you have lots of surveys returned. Having a few negative ones here or there isn't really going to affect you very much. But when we only have, you know, 10 surveys returned, if 4 people were unhappy, that's a 60%. So the fact that we've maintained greater than 90%, in fact 95% for FY20 is just phenomenal. And I couldn't be more proud, and I'll be the first one to say that, again, it's all you. I mean, yes, the leader has a lot to do to grow and push and prod, but I don't feel like I have to do that very much with you guys because you're amazing. So I'm very proud of you. I know our leadership team, Ben and Rob and Dr. Oberholzer, they're super proud too. So it's difficult to give awards when we can't get together and have celebrations, because if I said it during huddle, I'd have to say it like every single day for a week. So that's why I opted to do it here. But I definitely think you're living the Aspire value of excellence. So keep going, keep pushing. You know, I'm really proud that we're one of the 4 service lines that's been identified, where the priority and the focus is going to be put, again, even though that means more eyes on us. But I'm proud of that, and I hope that you are too. So with that, that's all I have for today. I hope you have a great weekend. Stay safe. Let me know if you need anything, and see you later.